World Bank was ready to negotiate with the government of Sri Lanka for assisting Sri Lankan health sector for the third time during the millennium. Dr. Deepika Atigala, Senior Health Specialist of the World Bank, and Dr. Jayasundara Bandara, former Director General of Health Service, being the project coordinators, were entrusted to design a homegrown model for investment. A technical committee comprising of members who have a vast range of national and international experience was appointed to guide and direct the officials engaged in the planning process. World Bank too was represented by a panel of senior officials to share international experience and assisting preparing the concept paper. To proceed the consultation process under the guidance of the technical committee, another 7 experts with different caliber led 7 thematic subcommittees. More than 50 senior health officers, specialists, and university academics worked in these subcommittees. This wide array of stakeholders through an extensive consultation process with over 200 Sri Lankan citizens, including healthcare providers, both in the public as well as private sector, academics, civil society advocates, development partners, and international technical advisors. They carefully analyzed the current system's strengths and weaknesses as against future priorities. Despite many challenges predicted, groups finally came up with a concept recognizing primary healthcare in Sri Lanka, preserving our progress, preparing our future. Through a successful process of negotiation, finally, World Bank signed an agreement with the government of Sri Lanka for a loan amounting to $200 million United States dollars. The dream was about to come true. Primary Healthcare System Strengthening Project was agreed upon to be implemented by the Ministry of Health in collaboration with Ministry of Provincial Council and local governments. The project expected results of primary care reorganization in 5 action areas. Action Area 1: Primary Healthcare Policy and Standards defined to support implementation. Cabinet of Ministers approved the policy on healthcare delivery for universal health coverage. Ministry of Health established and issued guidelines for organizing primary medical care services in Sri Lanka, which clearly explained the population empanelment procedure to improve the accountability of primary care providers. In order to guide the health staff at different care levels, Sri Lanka Essential Health Service Package (ESP) was published with the aim of leaving no one behind. A circular was issued on spatial norms for primary healthcare institutions to ensure the delivery of essential health services package. The first PMCU designed according to these norms was constructed under the project in Pallevala in Gampaha district. Ministry of Health together with project preparatory team published the roadmap of the PSSP, agreeing to start the implementation in minimum of 50 institutions in 2019 and cover at least 550 PMCIs during a period of 5 years. Action Area 2: The project intends improving the system to strengthen primary care provider functions and capabilities. Even a small institution such as Primary Medical Care Unit collect information of its empaneled population based on the Grama Niladhanri divisions. All males and females over the age of 35 years and registered in the Health Information Management System, a computerized cloud-based platform, and a personal health identification number is issued. As a subsequent visit, information can be accessed using a barcode easily. To facilitate retrieval of PHN if forgotten, is linked with a telephone number, national identity card number, senior citizen's number, passport number, driving license number, or any local reference number such as household number or clinic number. From time immemorial, primary medical care was almost limited to outpatient care. People who feel and realize that there is same thing wrong with their health or actually suffering from an illness come and demand for treatment. By that time, they may have lost few days or even months of their quality of life as well as economical productivity. During the primary care strengthening process, capability of primary medical care provider has been enhanced. Healthy lifestyle clinic activities have been strengthened so that people over 35 years in their empaneled community have been subjected to undergo screening for risk factors. Risk prediction chart of the World Health Organization is issued for risk categorization of those who were screened. Those who have a tendency to increase their body weight or tendency to become obese are instructed to engage in weight-reducing exercises. Those who are at moderate risk with slightly raised blood sugar, cholesterol level, blood pressure, or slightly raised body mass index are given appropriate consultation. Those who are at risk are continuously focused up to the medical clinic to ensure that all raised risk factors are kept under control. In order to effectively increase the population screening and also to help those who cannot attend healthy lifestyle clinics due to various reasons, health staff in many areas go to their doorstep to conduct outreach clinic. PSSP try its best to extend the medical supply management information system to primary care institutions. Once trained, pharmacists and dispensers through the MSMIS system can take prompt actions to ensure the drug availability in their institutions.
With this system, it's easy for us to order drugs from our MSD, as well as we can see where the drugs are available.
Early detection of many risk factors in non-communicable diseases is critically important for controlling and managing these risk factors, preventing the complications. However, establishing laboratories in all primary medical care institutions is impossible due to various limiting factors. The main limiting factor is scarcity of human resource. Therefore, PSSP has promoted establishing laboratories in some PMCIs, and close by hospitals are allowed to send samples, thereby making a laboratory network. A successful primary healthcare delivery to ensure universal health coverage, leaving no one behind, cannot be accomplished if the beneficiary community is not properly organized for engagement. Friends of Facility Committees have been established in every PMCIs. These committees work hand in hand with hospital staff to get down citizens for screening programs and also to improve infrastructure, making the hospital beneficiary friendly and intervene with determinants of health. For strengthening the health system, PSSP worked hard with the Ministry of Health to establish grievance redress mechanism. Ministry of Health believes that this GRM certainly improve the responsiveness. Based on the evidence of these health system strengthening, World Bank has so far dispersed more than 123 million USD to Sri Lanka. These funds have been effectively invested to improve the quality of services and facilities in primary healthcare institutions.